Welcome to the Life After Cancer podcast, made possible by the National Lottery Community Fund. I'm Steph, founder of Life After Cancer. I've been through cancer myself, and I know that when treatment ends, life doesn't always return to normal. Here we talk about the emotional, practical, and often invisible parts of life after treatment through lived experience and professional insight. These conversations share real experiences and perspectives. They're not medical advice and can't replace support from your healthcare team. If you're navigating life after cancer, supporting someone you care about, or working in cancer care, you're in the right place. Let's begin. Have you ever walked into a room and completely forgotten why you're there, lost your words halfway through a sentence, or read the same email 3 times and still not taken it in? If any of that sounds familiar, you're not alone. Today we're talking about cancer-related cognitive changes, often referred to as chemo brain. For many people, these changes can feel very unsettling. You might find yourself quietly wondering, is this normal? Will it improve? Or is this just how life is now? And despite the name, you don't need to have had chemotherapy to experience this. Cognitive changes are recognised in people treated for cancer, not only those who have had chemotherapy. But understanding that doesn't always stop the worry. So to help us make sense of what's actually happening and what can genuinely support recovery, I'm joined by Professor Nazanin Derakhshan, Professor of Experimental Psychopathology. Following her own cancer diagnosis, Naz has conducted extensive research into cancer-related cognitive changes. Her work has developed practical ways to strengthen cognitive and emotional resilience and improve workability, while also reducing anxiety and low mood. She's founder of the award-winning BRIC Centre and director of the Growth and Resilience in Trauma Centre at the National Centre for Integrative Oncology. We're also joined by Rosie, who was diagnosed with breast cancer in May 2024 and carries the BRCA2 gene. She finished active treatment in October 2025. She's now 40, a mum of 2, and works as an obstetrician and gynecologist, which she says probably doesn't make her the best patient. She loves being outdoors and exercise has become her therapy. Let's begin the episode. Lovely. Welcome both. Rosie, I'd love to start with you. Could you tell us a little bit about your cancer experience and where you are in that journey now?
Sure. I'm Rosie. I was diagnosed with breast cancer when I was 38. I've just had my 40th birthday last week. I finished.
Happy belated birthday.
Yeah, thank you. It's a bit of a milestone. I finished my active treatment for my cancer in September last year. So it was a full sort of 18 months of treatment. So quite a long process. Lots of surgeries. I had chemotherapy and immunotherapy. Also found out I had a genetic predisposition to cancer. Our family's got the BRCA2 mutation as well, so a bit of a double-edged sword. Yeah, but trying to just go back to normal now and resume some normality with life.
Thank you. Naz, what led you to your research in cognitive changes post-treatment?
Quite a bit of my work has shown that cognitive function, healthy cognitive functioning, has an important role to play in emotional resilience. And diagnosis and treatment of breast cancer affects emotional resilience. There are established findings on cognitive changes in women with breast cancer diagnosis and who've undergone treatment. And so in order to help women rebuild emotional resilience and survivorship, it's important to target cognitive functioning.
And please, could you explain what these cognitive changes, or what many might call chemo brain, is? You know, what are some of the symptoms?
So chemo brain has a few, terminologies. So you may have heard people talk about chemo fog or brain fog or chemo brain. So you don't need to have chemotherapy to have chemo brain, by the way. And brain fog or chemo brain relates to the changes in our cognitive function and cognitive structures in the brain brought about by cancer diagnosis and treatment. So quite a bit of my own work has showed that cognitive efficiency is affected. The efficiency by which we do our everyday tasks or perform well at work, these functions are affected. Working memory, what is involved in what I'm doing right now, is affected. Short-term memory is affected. Concentration levels are affected. Attentional focus, and people report quite a bit of distractibility as well, and forgetting names, words, and updating information in working memory. So, for example, I might be speaking with you, and suddenly I lose my train of thought, and I'm thinking, did I say that? Or maybe I did, maybe I didn't. So I fail to update information in working memory.
So on a day-to-day basis, what might that look like for some people? I know you gave a few examples.
You might be sitting in a meeting or listening to conversations, and you lose your train of thought, or you lose the train of conversation within a meeting. You want to talk about something to someone, and you have difficulty finding the words, and you might forget names as well. That's quite common, and you find that you have to try harder to do certain things that involves your attention, and it may take you longer to complete those tasks. Something that might have taken you maybe 10 minutes in the past may take you 20 minutes or so.
Rosie, can you relate to any of that?
Definitely. Yeah, it really does resonate, all of that.
And when did you notice those changes?
Probably during my treatment, especially, because obviously it's the chemotherapy especially is really full on, isn't it? It completely floored me, and not great timing. I had 2 small children as well, and lots going on. It's a busy stage of life, isn't it, when you've got a young family and a busy job. It taught me I had to slow down quite a bit, which I was quite accepting of during the treatment, and I got my head around that, but I probably wasn't as prepared as I thought I would be for the aftermath of all the treatment. I thought there'd be sort of a bit more relief maybe, and a bit more, everything's gone well and now I'm okay. Whereas I sort of hit this big roadblock and thought, I don't know if I can do my job anymore. You don't feel like the same person almost. It's not changed my personality, it's just changed how I deal with certain things and how I process things. It's made a huge impact. My relationship with my husband as well. Having simple conversations is a bit of a challenge, especially if I'm tired.
Tell us a little bit more about that. What was it like for you?
Quite hard, because I was quite a career woman before, so it was a big shock to the system, changing from I'm a doctor in obstetrics and gynecology, so really, really fast-paced, busy job. Changing from that to then being a patient, that was quite a transition, but I hope I wasn't too hard work for the team. I don't think I was. But just getting my head round, I'm not going to be able to potentially do this job as well as I was doing it before. I can definitely do it, but I need to make some adaptations to how I'm going to do my role, because there's a lot of decision making. It can be quite fast paced. You need to make decisions quickly. Those thought processes need to be ordered, quite structured, but also there's a lot of unpredictability, and you don't have much control over things. That's a challenge when your brain isn't working in the same way that it was. Yeah.
And what did you have to do to adapt?
I think just slowed down a bit. So I did notice that I'd have to just take more time over things, not apply as much pressure on myself as well. I think I probably was my own worst enemy and felt bad because I couldn't do it. I couldn't perform in the same way as I was doing before. So it's just being nice to myself and saying that we've had a really big, you've had a sort of hand grenade thrown at you, and now you're sort of just picking up those pieces, and it will take a bit of time and to get it back.
Did those symptoms, did those changes come as a surprise for you?
I found the end of my treatment quite challenging, much more challenging than I thought. So I remember thinking, oh, I'll be so relieved when all of this is over, but never had that. And I thought, well, that's strange. And then it's just getting used to that new normality, and everything sort of, you've got this security blanket of the team around you and lots of appointments, and you work towards those things, and that's reassuring. And when that's taken away, you think, oh gosh, I've got to put my big girl pants on now and face the day on my own. And it's a huge reality check. Yeah.
And I can hear for you that it had a huge impact on other parts of your life, like work.
Yeah. Yes, I've just gone back to NHS work a couple of months ago, and it's hard to explain to the team. They know roughly what's happened. Obviously, they're trying very hard to maintain confidentiality. It's really challenging, but you want to be honest and open as well about the difficulties, but there is a lack of awareness and understanding actually what the treatment does to up here. And they've worked with me before, so they think I'm the same person, but they're like, it's so great to see you, you're fine, you look really well. And I know I look well, but you sort of don't feel as well as you look. And that's really hard to translate to the team. And they're doing their best to be supportive, but at the same time, it just feels like a bit of a disconnect.
Yeah, completely.
Yeah.
I can hear that.
Yeah.
Naz, what are the wider impacts of living with chemo brain? So Rosie's given us an example of returning to work.
Doing everyday activities. An example just came to my mind, and I'd like to relate it. A friend of mine said that she couldn't even remember her own daughter's name when she went to pick her daughter up from school. So it can, be extended quite to a range of things, even everyday things. So workability is a big issue. And as Rosie summarised really nicely, employee understanding is key here to allow for adjustments and adaptation, to also protect Rosie's self-confidence and self-esteem in the job that she is executing, to be a bit like before, or even better, hopefully, in the future. Relationships can be affected when we are in situations when our brain needs to work harder and put more effort in doing the jobs we kind of used to do with little effort. What we are doing naturally is inducing fatigue, cognitive fatigue. And so we may feel more tired than usual. We may want to limit our social lives because we are tired to go out, and we miss gatherings, or need to go to bed earlier. We may not have enough energy to play with our children, or go to various events. We also are at risk of missing appointments for various things and making mistakes. So errors in, simple things in daily life can also seem a bit overwhelming for us. And so as time goes by and we notice these changes, there's kind of a knock-on effect on our self-confidence, and then lower self-confidence leads us to make more, be at risk of making more errors or lapses in attention and memory. And so it becomes a bit of a cycle that, feeds cognitive fatigue. Mm-hmm. And you can feel burnout. And you can doubt your own adequacy in relation to many things. For example, the workplace. You might feel, well, maybe I'm actually not that good enough to go for that promotion. Maybe I need to downscale a bit. Because I'm not that person anymore.
Can I just touch on what you said earlier about chemo brain? Because I know that you don't have to have had chemo in order for you to experience this. What else can cause these cognitive changes?
So the impact of trauma on the brain has shown to affect neural networks involved in cognitive and emotional resilience. Just the trauma itself, perception of the life-threatening event. Mm-hmm. Then dealing with all kinds of, new bits of information that you need to process for the treatment, for example, of the cancer or the aftermath of the trauma. There may be cancer-related changes on the DNA, and we're still trying to understand the impact of the cancer on cognitive function. We know that treatment can bring it about, but there can be an interaction there with the cancer itself affecting us. Because there are some studies that show prior to treatment and immediately after cancer diagnosis, the cognitive changes are apparent. If you are on endocrine therapy, for example, tamoxifen, it's an estrogen inhibitor. So we know that estrogen is quite important for brain function and brain vitality. So the neurotoxicity of tamoxifen and other endocrine therapies can contribute to brain fog and chemo brain. The fact that you don't need it, chemotherapy is absolutely valid, but chemotherapy exaggerates the cognitive changes. So there's kind of like an added effect of chemotherapy, added effect of endocrine therapy, and simply the brain having to deal with the overload of information and the impact of trauma itself on the brain.
Rosie, many people experience this, and what we see in the community is they doubt it's actually happening, or they question, is this part of menopause? Did you ever doubt yourself or wonder, am I the only person experiencing this?
Definitely. You do, don't you? I thought, have I just got sort of delayed mum brain? I'm dealing with 2 children, the multitasking of being a mum. You've always got 100 tabs open in your brain anyway, doing that role. And then the treatment that I've had, I'm not on hormone blockers, but the chemotherapy does have a big impact on your ovarian reserve and functioning. So it does have a knock-on effect with estrogen and puts you into a perimenopausal state. So then you start thinking, well, maybe I'm just a bit menopausal, a bit early. So you do start to sort of doubt, which one is it? And to be honest, it doesn't really matter. Mm-hmm. It's more about just the awareness of it and the understanding. I've taken a lot of time to do my own research, and I know I'm not on my own. I know it's really common. Mm-hmm. I used to feel like a bit of an alien before. My mum friends especially have been incredibly supportive, and say that they feel exactly the same. for other reasons, probably, you know, a bit of hormones, a bit of just parenting and life in general is just so busy, isn't it? So I know that it's not just me. Yeah.
And you spoke about it showing up at work. Were there any other areas of your life where it really kind of dominated that space?
Just the multitasking of parenting, especially. My kids are wonderful, but God, if it's full on, sometimes if they're both speaking to me at the same time, or if they both need something, I find it really difficult to sort of they do understand now. I've had to explain it really simply to them that I'll just give mummy a minute. It makes mummy's brain hurt when you both come at me like that. Maybe just one at a time. It's trying to be clear with them and explain in really simple terminology. But actually by doing that, it made me realise what I need to make it better. So they've been very good. But parenting it's hard anyway, isn't it? So without all of this on top.
And Naz spoke earlier about how it can knock confidence at work, and you can start convincing yourself, actually, maybe I shouldn't go for that promotion because of, you know, how I'm approaching work, and that internal dialogue you spoke about as well. Were there moments in your life where it felt like it knocked your confidence?
It definitely has knocked my confidence. I think I've found going back to a hospital environment quite overwhelming, because it is a stressful environment. There's lots of adrenaline. There's lots of things going on, and obviously there's unwell patients. So that can be a bit close to home, isn't it? There can be triggering. It's all a bit of a stark reminder, actually, that we're all human beings at the end of the day. And what I try and remember when I'm doing my job is just kindness goes a long way. Kindness and just being open and honest and just being nice and listening. Clinically, I might be a bit rusty. That's going to take a bit of time to come back. But I think so far, most of my patients really appreciate just me being honest, which is what I've done.
That's brilliant, isn't it? That you feel you can be honest with them as well.
I am really honest. Yeah. I've been honest with the department as well, and with the other the doctors that I work with. Just say, look, this is the situation. If we're doing a ward round and I go and have a hot flush in the corner, just carry on. Just give me 10 minutes, it'll go down, and then I can come back and carry on. Or I just sort of try and brief them before, and then they're fine with that.
That's interesting, because I wanted to ask, is there anything that you wish your colleagues or your workplace knew? But it sounds like you've been able to actually communicate that with them.
It's a hard balance to strike, isn't it? Because I think the sort of wider team are trying to maintain, understandably, a bit of confidentiality, and not. It's you don't want to know everyone's medical history, but I think when someone's returning to work after cancer treatment, I think it's actually more important that you do know the situation. I think it's really important, as long as that individual's happy for it to be shared. I think otherwise, how on earth are we going to increase awareness and education about how it feels? And so that's what I'm trying my best to do, is just be just really honest and say, look, I try and sort of add a bit of humour to it and say that I probably will have several hot flushes today, especially when I'm scrubbed in theatre. I will definitely have a hot flush. Just be supportive of it, and we can talk about something else and it'll go away eventually.
And Naz, we asked in our WhatsApp group, has anyone got any questions? And the question that kept coming up was, does this last forever? The big question. Tell us.
It's a very good question. There is evidence at a neural and behavioural level to show that chemo brain effects can last up to 20 years post-active treatment
Okay.
for breast cancer. And chemobrain has been studied more in breast cancer, by the way, but
Okay.
does exist in other cancers as well. Absolutely, it's been documented. However, the trajectory of changes regarding cognitive changes relating to chemobrain over time is unclear. We can't project a linear decrease or a linear increase. It depends on your coping strategies, how chemobrain is managed, and a number of behavioural factors that we are investigating at the moment. To think in terms of this is going to last forever, therefore I'm doomed, is not helpful. We are all at risk, of one thing or another, and people with cancer diagnosed and treatment are at risk of longer lasting effects of chemobrain. However, there are activities that we can engage in that can help us on a day-to-day basis. So it's a bit like saying, am I going to feel like this forever, or am I going to remain, with this kind of mental disability forever? The short answer is we simply don't know. The long answer is that there is hope.
Mm-hmm.
There is hope, and we can see chemobrain as part of us, not something that's going to rule our lives.
Mm-hmm.
So that's the approach I think is good to take.
And there will be many people who listen to this who wouldn't have had breast cancer. They would have had a different type of cancer.
Absolutely.
What would the answer for them be?
Same.
Yeah.
Chemobrain has been documented in nearly all the cancers I've studied. And same for you, all the other cancers, there is hope. We are, at the end of the day, more than our cancer, more than our chemobrain, and we will be able to manage it. It's hard. It's not an easy task because it directly relates to our identity and who we are. But we can kind of, manage, control, navigate our way. The idea that we will eradicate chemobrain is something that it is a bit dangerous to think of it that way.
Okay.
No, because the drugs are the same, the treatments are the same, the cancer's the same, unless we have a breakthrough of some kind, which won't come soon. But what we can do is to use the tools to help us manage chemobrain effectively.
I can hear that you're saying, well, how we approach it
Yeah.
can change, how we see it. But does anything else depend on how we might experience chemobrain, regardless of the treatment that someone might have had?
Yes, I think validating the experience is important.
Okay.
When the experiences relating to chemobrain are not validated, the person starts to doubt themselves. And therefore engage in behaviours that may be unhealthy. So validation of the experience is the first step to understanding the nature of the experience and then thinking about various ways by which we can manage chemobrain. Let's remember that some of us are more vulnerable than others. And for some, it can be more difficult to manage chemobrain. So not a one-size-fits-all approach here. We have to be very mindful of that. Acceptance of the fact that, yes, life can be different. Life may be different for a certain set of time. We don't know. There's uncertainty involved. But it is just one part of the experience. But validation is important. When we don't validate the experience, we kind of like take a detour and try and find ways to cope with the phenomenon without understanding what it is.
That's So brilliant to hear, isn't it? If anyone's going to take anything from this, to take that. So let's go back to what you spoke about earlier. We were talking about how do I know if it's menopause, or how do I know if I'm getting older? I'm juggling life. You know, I've got a family, I'm really busy. And I love what you said, Rosie. You said, well, it doesn't really matter, does it?
Yeah.
And I guess this echoes what you're saying as well, of just validate that it is happening.
Yeah.
Is it important for us to know why we might be feeling this way?
What I'd like to say is that, first of all, the younger we are,
Yeah.
the greater the experience of this kind of menopausal related symptomatology. So as Rosie said earlier, chemotherapy puts you into a, radical menopause, and then endocrine therapy as well can, do that. So, but chemo brain may have similar symptomatology to menopausal brain. Okay, so similar symptomatology. When you are younger and you're premenopausal and you experience treatment-induced menopause, the impact is much greater. And the research has shown that younger women, in fact, have worse cognitive function as a function of treatment and cancer, and they have more radically induced menopausal symptoms, including anxiety and depression. Being younger and being female are both risk factors for increased cognitive and emotional vulnerability. And this goes across nearly all cancers, apart from prostate cancer, of course, which men get, whether it's menopause or perimenopause or postmenopause. At the end of the day, lots of factors can be contributing to it. It might be natural aging can also contribute to it, but you have an added effect of the cancer and the treatment on top of the natural aging. Many people have questioned me when I talk about cognitive function that it could just be the natural aging process. Well, yes and no. You might be diagnosed in your 30s and then feel like you're, you have a brain of an, maybe much older person, like 80 or, So sudden changes like that are and can be more difficult to manage. Thinking that, we're going to set it aside, adjust our lives and give in to chemo brain is not the way to go. But accepting it will give you the grounds to do something about it. So acceptance isn't surrendering here. It's validation and then action.
I love that. Accepting isn't surrendering here.
Yes, it's sometimes we're all doom and gloomed and there's no hope and what's the point? No, in that way we are opening ourselves for increased risk of depression and helplessness. And we don't want that. We don't want that because that's another thing to address.
So I'm just going to read out this statement that someone popped in our WhatsApp group, which I think you've already answered, but you might have something to add. I had chemo brain during chemo and immediately after, but was then put into chemical menopause from tamoxifen and Zoladex. So I still have terrible brain fog 2 years on since chemo. Is this now menopause brain or is it a mix?
Depending on the age, it could be a mix, or it could just be treatment-induced chemo brain or menopause. Because cognitive functioning is kind of a risk and resilience factor for emotional functioning, emotion regulation and so forth. The two go in hand. So if we are cognitively vulnerable, we are more prone to depression and anxiety. My own work has shown that. And as Rosie said earlier, whether this is a natural menopause or whether it's a treatment-induced or whether it's, the tamoxifen, they all can lend hand to each other. And at the end of the day, the symptoms are there to be addressed. However, they have come about. So the mechanisms can be the same. as well as the treatments. The labelling may be a bit different. Again, depending on age, some people I know have had radically induced menopause, chemically induced menopause, and then when they've got to a menopausal age, feel like they're kind of going through menopause again, or feeling similar symptomatologies coming on again. So the body acts in strange ways, and even if it's naturally induced menopause, there are ways to, invigorate the brain and invigorate your well-being. So yes, it doesn't matter what it is; it can be addressed.
I love that attitude. I love it. You're like, regardless of what this is, we've got a solution. Can I ask, for people who are living with ADHD, does chemo brain show up differently for them?
This is a very, very good question. We need more research on the experience of cancer, navigating through challenges that cancer brings for neurodivergent populations. Autism is one of those, ADHD, attention deficits, and many other related. Of course, it will have a bigger effect for individuals who already have a predisposition for attention deficits. The literature is scarce on addressing the mechanisms that, contribute, but also ways by which, we can be aware. I think that what we need to do is, from diagnosis onwards, try and be aware of individuals with neurodivergency, because they may need special need care. For example, with autism, attention deficit disorder as well, they may need more time to process information. So when they're speaking with their oncologist or surgeon, they may not take everything in immediately. Or maybe when they're in having chemotherapy, the room might be a bit busy, and, that they might have like maybe a mental meltdown, or, so to validate that, to take into account, to raise awareness that we are all different and some may need special help. And so the experience of chemo brain for individuals with attention difficulties, needs to be considered. It will be more distractibility, I would expect.
Rosie, are you still experiencing cognitive changes, or do you notice a difference in how you are now versus, when you just finished cancer treatment?
I think I've come a long way since I only finished treatment in September, so it's not that long ago. I finished my chemo over a year ago. But I try and remember that obviously the medication's super strong, isn't it? It's designed to be strong for a reason. It kills all the cells. So I just need to give my body and my brain a bit of time to grow back. Mm-hmm. That's how I describe it to my children. I'm growing everything back slowly, but it's getting there.
I love that visually as well.
Yeah.
You can really see it, can't you?
I'm growing my cells back. I said to my oncologist quite a few times, multiple appointments, I'd say, I feel like I've had half my brain removed. Literally half of it's missing, and it's not fully back. It's probably about 70% there. It just takes time.
And I hear that the time has been short for you in terms of when you finish treatment.
Yeah.
And I love that you can see your brain at 70%.
Yeah.
What was the percentage when you finished treatment?
Oh, probably about 20.
Okay.
Yeah.
That's, I think, quite hopeful.
Yeah.
For anyone listening, and I hear that it can last up to 20 years, as you said, Naz.
Yeah.
But that you have seen a difference.
Yeah. A big difference. I've learned how to manage it better. When you said about acceptance, that's a big thing, and just acknowledging really what what a big thing it's been for my body to go through. It's not an easy thing. I wouldn't wish the treatment on anyone. So I have to just try and remember that to sort of validate how it's a huge thing, isn't it? And I think ultimately it'll make me much better at my job, having that understanding of what it feels like to A, be told that news, and B, have it's got really life-changing treatment. And yeah, and you're absolutely right about the trauma to the brain, and sort of almost having that PTSD. Your brain protects itself, doesn't it, from further trauma. Yeah, I find it fascinating. It's really interesting.
If someone has just finished their cancer treatment and they're listening to this, what would you want them to hear?
Oh, there's definitely hope and light at the end of that long tunnel. That it does get easier. I think you just have to be kind to yourself and listen, and just take a moment to just pause and reflect. It's made me put things into perspective and prioritize what's important and what's really not. Yeah. And work's important. It really is. But at the end of the day, it's not as important as your health and your family. Yeah. So it's just sort of readdressing.
Naz, tell us, what does actually help with Chemo Brain?
So I'd like to categorize it in like 2 self-help tools, so we can do these ourselves. One of the things that Chemo Brain affects is neuroplasticity. The brain is plastic, and that's how we learn things. Okay, if we didn't have plasticity, we wouldn't be learning anything. We wouldn't be, remembering. We wouldn't be able to focus. We wouldn't be able to inhibit irrelevant information and attend to relevant information, or multitask for that matter, not switching between different modalities. Chemo Brain indicates that plasticity has been ruptured in the networks that are responsible for our everyday activities and more higher order thinking, like decision making, doing our job right, surgery, for example. Keeping the brain active. So remember what I said, accept but don't surrender. Oh, my brain is all mush, there's no point, no. The brain is very, very smart, and it will reawaken. So challenging your brain using different kinds of activities. Now, immediately someone might think, oh, does that mean brain training? Standard brain training exercises have been criticised. However, there are certain cognitive exercises which we have validated and we have shown to have long-lasting effects on symptomatologies in terms of reduction of anxiety and depression and improving workability. Up to 1 year follow-up, right? So in our randomized controlled trials, we have provided evidence that challenging the brain in adaptive ways, again, listening to yourself, kind of, adjusting and adapting, but keep going, So in a way, you're playing games with your brain and you're keeping it on its toes, and you're challenging it. I'd like to start by doing something different every day, So small steps and adapting to it, but not sticking to various habits, So even, for example, the way you go to work every day is the same route. Take a different route. New information. Oh, the brain starts kind of firing, new processing new information. And then some cognitive training exercises, which we have validated for various kinds of populations, not just cancer populations, but other populations dealing with PTSD and so forth, have shown to improve plasticity. And when plasticity is improved in the brain, the prefrontal functions that are more involved in decision making, attention, focus, cognitive efficiency, start regulating the emotional parts of the brain, the emotional networks in the brain, that's like the amygdala that's firing towards, all kinds of cancer-related cues and amplifying the experience of the trauma and so forth. So communication between brain systems involved in resilience improves. If you want to kind of think of it as a seesaw, so there's homeostasis between your emotional and cognitive networks when these two systems start speaking to each other. Well, it doesn't happen overnight. And we have seen that cognitive training itself can lead to behaviors that then can consolidate the changes in the brain. So, for example, as a function of cognitive training, you might decide to engage more in some self-compassionate exercises, putting yourself first, prioritizing those behaviors, reinforce the plasticity. The plasticity again reinforce new behaviors and so forth. In addition to kind of keeping the brain challenged, challenging the brain, is sitting with the difficult emotions through relaxation training, through relaxation exercises. And mindfulness is a good way to go, non-judgmentally about yourself. Now, it's really hard when you are experiencing chemo brain to do mindfulness. Why? Because you have to keep focusing on something, and that distractibility is high, but not beating yourself up about the fact that you are distracted. But slowly, these exercises have shown to improve neuroplasticity, to improve connectivity in the brain between the systems that bring homeostasis. So your sympathetic nervous system kind of calms down, your parasympathetic nervous system becomes, activated. And so sitting with the emotions, mindfulness training, relaxation training, and cognitive training. Recently, we have extended and developed a new training based on breathing techniques, and it's just breathing with biofeedback. So being mindful about the way you breathe, not simply breathing and mindful breathing, but with feedback to help you breathe better. It's called 6 breaths per minute breathing exercise. Again, that is based on the premises of being mindful about the breath, exercising attentional focus, exercising selective attention, which is difficult to exercise when you have chemo brain. It's like giving yourself the time, acknowledging, but not the surrendering. Something else that has received less attention, but given the work I do, I have seen the mechanisms being involved actually in brain health. Positive reinforcement, rewarding yourself for small accomplishments. We always kind of tend to remember the negative. I didn't do well, or I failed that. I didn't say this and I should have said that. But kind of shifting the mindset on, I managed to remember the name. I didn't forget the name. Isn't that just kind of, it's a minor thing? No, small achievements usually have the biggest impacts. And being mindful of those small achievements, because you are positively reinforcing the networks involved in the neurotransmitters that are going to make you feel good about yourself. And that's what we want to encourage with the brain. So write down at the end of the day, maybe 3 things that you felt proud of yourself for doing small things.
They're just absolutely brilliant, aren't they? And things that you can actually take away and do at home, because I think there's so much out there that feels quite unachievable, but everyone can get a pen and paper or get the notes on your phone and just jot down
Exactly
3 things at the end of the day.
Exactly, yeah.
Can I ask, is there anything that makes chemo brain, the cognitive changes, or implementing any of these actions a little bit harder, such as being tired or a little bit stretched in life?
Really, really good question. We are creatures of habit. The days go by and we think, oh, I wanted to slot this 10 minutes in, but I didn't prioritize those 10 minutes. 10 minutes maybe before you go to bed or in the morning. Again, being mindful of saving that time for yourself, maybe writing it down, not letting other things take over. It's so easy. I say this, and I'm probably one of the worst in adhering to. Adherence is difficult, but start small, because if we take big chunks, it's difficult to climb that ladder. Maybe start with 2 minutes a day, or maybe one positive thing a day. Or you can't, I can't think of 3 things. What's the point? A bit like when people sign up for the gym and they don't go to the gym, or they want to go for that run and they don't find the time to go for that run. If it's a small chunk, then we surely, will be able to do it, and then maybe increase, because that small thing will become part of the habit. And then you think, well, I want a bit more of that, bit more, because it's making you feel better about yourself. And then implement in daily life. And if you have lapses, that's fine. It doesn't mean it's going to stay like that forever. You can rectify the following day.
Rosie, what was the one thing that made the biggest difference for you
in helping the symptoms? Probably exercise. I found I developed a bit of a passion for Pilates, which I found sort of encompassed everything from breathing, a bit of mindfulness, concentration, because you really have to concentrate when you're doing Pilates. So it took my brain away from other things that I was thinking about, because I was having to just focus on, I don't know, holding this position, but also felt like I was getting a nice good workout. So it was good therapy and healthy. Yeah. So I'd really encourage during treatment and after treatment to exercise and stay active. Even just go for a walk, try and a half an hour walk a day. It just makes such a big difference to up here. Yeah.
Pilates is great, isn't it?
Clears your head.
Yeah. And it's great at, like you said, changing it up, because in Pilates they'll say, oh, get your left leg to do that thing that you've never done before, and your brain's like, oh my goodness, how do I even get it to that position? You're very present, aren't you, in that class? And
amazing for proprioception, balance, core, strength. It sort of ticks all the boxes. Yes. Especially it's really important after the treatment to try and stay strong and keep your bones and joints strong, especially if you're on hormone blockers. Absolutely. So I've found it, that's my go-to.
Exercise also improves neuroplasticity in the brain, and it improves the brain-heart connectivity as well. So definitely, I would also recommend exercise. Now, some people, who've been maybe athletic prior to being diagnosed with cancer, may feel a huge shock to the system. That will we ever be able to run? Will we ever be able to perform that way? And now, when we just take a walk up to the top of the road, we're out of breath. Consider your baseline has dropped now. So walking to the top of the road is a bit like, feeling triumph and achievement from doing a 5K. You've done a 5K, your baseline's dropped. But gradually it can improve. You can bring your baseline up. So I've heard people say to me, I'm not going to be able to do the run. I'm not going. And years later, they have been able to do. And giving yourself a pat on the back that, yeah, I managed the 5-minute walk up the road and got there. It should feel like when I did a 5K or 10K before. So yes, that's an achievement. That's a positive reinforcement.
So we've just got a few more minutes before we come to the end and I ask you a kind of quick fire round. I'd just like to ask you, Rosie, is there anything you'd like to ask Naz based on your own experience of these cognitive changes?
I think probably at the beginning of the session, I would have asked if it's normal, and you've answered that question. It is very normal, and there's no problem with having these symptoms that feel quite life-changing.
Yes,
but what you've really reinforced for me is just that it's really normal.
Yeah, it is normal, and it's expected, and up to 95% of individuals with a cancer diagnosis experience chemo brain. So it needs to be talked about more, and it's the vast majority. Yeah.
It'd be nice if the medical team had maybe sort of educated about it a little bit, or said this, you'll probably find this afterwards. There's not really any mention of it. You sort of have to go and find the information yourself, don't you? And
that's a job in
that's
itself,
quite
isn't
challenging.
it? In addition to everything else.
But obviously your medical team are there to fix you, aren't they? And they're for the acute stage. The aftermath, I think, needs a bit of work.
Absolutely.
Yeah.
I mean, it's a bit like your journey starts then when you're discharged after active treatment. Contrary to expectations, people do expect you to be back to where you were immediately, but that's not the case, as we have explained today.
There's one question I'd like to ask, which is, when should someone seek support? How do they know if the actions that you've shared are enough? And when do they think, actually, I need to speak to somebody about this?
When they significantly interfere with their well-being. So what I mentioned earlier is that some of us are more vulnerable than others. So we don't know the past history of the person with a cancer diagnosis. Some people have gone through multiple traumas in the past, have diagnoses of anxiety and depression, maybe have had PTSD, and so they're more vulnerable. So when they experience these symptomatologies to a greater extent and they become fearful of how it's affecting them, they need to seek help, definitely. By help, meaning, like a clinical level of help. We have systems in place that can address. You could start slowly with exercise or the techniques that I mentioned. But if you feel that you are vulnerable and you fear the experiences that you're undergoing, you should seek help. Yeah, definitely.
Thank you so much, both. I've got a quick fire round. Rosie, I'll start with you. What did you expect life after treatment to be like, and what was the reality?
Expectation, relief. Reality, overwhelming.
What surprised you the most about life after treatment? It can be good or bad.
The aftermath, the resuming normality, trying to find a new normal.
What's one thing you wish someone had told you about that stage?
That it's okay. Take your time. Yeah.
What's one thing no one tells you about life after cancer?
Uncertainty.
What helped you the most after treatment finished?
Humour.
What do you wish someone had told you what to expect?
Again, uncertainty.
What's something people said to you after treatment that wasn't very helpful?
When are you going back to work?
What could they have said instead?
Take your time. There's no rush.
What's one small thing you'd share with someone who's just finished cancer treatment that would support themselves?
Compassion and kindness. It goes a long way.
And if you could send a message to your post-treatment self, what would you say?
Oh, that everything will be fine, because it will always be fine in the end.
And what do you wish your healthcare team or potentially a consultant you work with knew about life post-treatment?
Oh, that's such a good question. It's easy to get to zone out almost. When you're in that environment, you almost get desensitized to things. I certainly do in my job. And it's just about being a bit more sensitive to what's going on and keeping that awareness. Yeah.
Thank you so much, Rosie.
It's okay.
Thank you. Naz, can I ask you some of these questions? What did you expect life after cancer treatment to be like, and what was the reality?
I felt that I had recovered, and the reality was very different. Not what I had expected, not recovery. It was harsh. That was the reality. And for many women that I've worked with, it's a harsh reality.
What surprised you the most about life post-treatment, good or challenging?
The lack of understanding in other people about my situation, and that I was still experiencing the aftermath, and their expectations that I was well, I looked amazing when I felt awful, and things that they said were upsetting to me. Like if cancer would affect anyone, it's come to the right person because you are so made for this. Why? And I think women agree, that the women I've worked with, that it's very different, the aftermath and the challenges and the uncertain nature of recovery.
Yeah. What's one thing you wish someone had told you about that stage?
Like Rosie said, uncertainty. And be prepared to be surprised in unpleasant ways. Yeah. Anything is possible.
What's one thing no one tells you about life post-treatment?
The reality of it, the uncertainties, the roller coasters, the challenges, recurrence, metastatic disease, your chances. The new normal is a vague terminology that doesn't quite mean anything. That life is ever changing, and the uncertainty together with the changing, uncertainty and changing.
What helped you the most after treatment?
It's really interesting, this, and I'm going to get a bit emotional. My students, actually, and my work and my students, and Brick, the centre I founded. My tribe helped me. Yeah.
Thank you, Naz. I think it's really important as well to hear how your work can be that for you too. Yeah. And it's not always seen as a negative. You know, it gives us purpose. It
Yeah.
sits with who we are, our identity.
Absolutely. And bringing, making brick part of my work and my identity. It's very unusual, but I think I have survived because of brick and because of the research I do and because of the support that as an academic I received in taking my work further and my research further. So, and my students have done amazing pieces of work, PhDs and so forth. And I think, it kept me going. It gave me hope that you can make a difference. And to see so many women, vulnerable, but have amazing resilience in them that they have found within them, and they have taken steps to not only improve their own well-being, but improve other people's well-being. It's beautiful, and I think that gave me hope. Yeah.
Thank you. If you could send a message to your post-treatment self, what would you say?
The understanding and empathy are two of the most important things. Everyone has a point, and their points are valid. And to have empathy means to have understanding of the other person. And I think empathy is one of the most important things post-treatment. Empathy for yourself, not feeling sorry for yourself, but having empathy and for another as well. Yeah, I think I have learned that.
And what do you wish doctors or healthcare teams understood a little bit more about in terms of post-treatment?
It's difficult to keep the balance right for doctors. They want to see you well and flourishing, etc. But there's a long road ahead. To raise awareness of the possible roller coasters, ups and downs, post-active treatment. But the patient is not alone. Never feel like you're alone. There is help, there is support, and we can help you find it. I know doctors are stretched. I very much agree oncology is very, very much stretched. But to be able to signpost people to sources of support, and that their door is always open should we need to kind of go back, but that they hope for us to be independent as well, because we don't want to take up more time, the precious slots that they give patients who may need them more than we do. I fear for their health as well. They suffer compassion fatigue, they suffer burnout. I have seen the rates of burnout and compassion fatigue in my own oncology team, and I don't want to be in a critical position. Yeah.
Thank you.
Yeah.
Thank you so much, both. Thank you for your time today. You're both absolutely incredible. Thank you.
Thank you so much.
Today, we've talked about cognitive changes and what they can look like after cancer treatment. Over the next few days, notice one moment where your brain feels tired or foggy. And instead of pushing harder, try one small adjustment to support yourself. That might be writing something down, slowing the pace, or asking for more time. Sometimes it's the small shifts that can make everyday life feel a little bit more manageable, and remembering that can make a whole load of difference. Thank you for listening. If you'd like support or community, you can find free online workshops, expert sessions, peer groups, and our 6-week programme at life-aftercancer.co.uk. If this episode was helpful, you can follow the podcast or leave a review. It helps others find these conversations. Support information is always available in the show notes. Take care, and we'll see you next time.